DJ is a 56-year-old white female with a medical history of major depressive disorder, generalized anxiety disorder, and complex post-traumatic disorder. She reports taking medication for mental illness. She also has post-concussion syndrome from violent assaults in the past. She has a history of alcohol abuse but is being sober for the last 27 years. She reports a history of childhood trauma. She's being seen by a psychiatrist in a community-based clinic, and she's being referred for occupational therapy services by her case managers. She's currently living in a woman's shelter and has a private room. Some occupational performance concerns for the year are she has never been engaged in many cooking tasks and she receives most meals at a food pantry. Jay has difficulty with mental health management and symptom management. Some of her occupational performance strengths are DJ has a history of living independently, including being independent in ADLs previously. DJ likes to keep her apartment clean and engage in cleaning routines every day. Some of the underlying factors of this diagnosis are poor executive functioning, such as difficulty with attention to tasks, sequencing and problem solving, concern with cognitive process, and poor emotional control, which impact all her daily occupations, such as activities of daily living and instrumental activities of daily living, such as cooking, cleaning, shopping, etc. Two frames of reference that I will use for DJ to justify services will be the cognitive frame of reference and the cognitive behavioral frame of reference. The cognitive frame of reference will aid me as an OT in developing interventions to help DJ implement cognitive strategies. For example, DJ will have to identify task difficulties during cooking activities and implement problem-solving strategies discussed in the OT group. In the cognitive behavioral frame of reference, state that behavior is associated with mental illnesses and are maintained by cognitive factors. For example, during nutrition group or cooking plan, DJ will have the opportunity to demonstrate cognitive strategies such as implementing positive self-talk or verbalizing positive affirmations that counteract negative beliefs. While providing occupational therapy interventions for the year, I will implement cognitive training such as remove irrelevant stimuli, use auditory and visual cues, address internal distractions such as anxiety or overwhelming situations by having DJ implementing positive thinking. I would recommend DJ to use memory aids such as calendar, checklists, and clocks to remember the activities that she has to do. I will help DJ simplify tasks such as practice problem-solving situations such as in preparation for cooking tasks. Limit the number of options, teach her to step back and think through important decisions to facilitate problem-solving. For cognitive behavioral intervention, I will help DJ implement coping skills such as positive self-talk, write or verbalize positive affirmations to counteract negative thinking, schedule and engage in meaningful activities, and will implement cognitive training such as simplifying tasks to incorporate opportunities that are repeated practice that will help her with automatic processing. The assessments I will use are bottom-up. I will use the MoCA, the Montreal Cognitive Assessment, which is a cognitive standardized screening tool used for individual IDGs with depression and mild cognitive deficits. This cognitive screening tool will help me assess her attention, concentration, executive function, memory, conceptual thinking, and orientation. By having a baseline knowledge of Davis cognition, I will develop a plan to address occupational performance interventions, including safety necessary for tasks such as health management and cooking. The top-down approach I will use is the executive function performance test to determine how executive functions impact DJ's individual capacity of independence and how much assistance she will require to complete a cooking task and live independently in the community.